So next meeting we'll have the final examination. So today is August 21. So 29 August. May. Okay. May 21 man karon sa 29. 29 ba? Ito check. Sakto ba? So May 28, we'll have final examination. Then coverage for our final exam, it's comprehensive. So from the first topic, which is bilirubin to magnesium. Okay. So it's comprehensive, 40% before midterms and 60% after midterms. Okay. Regarding the breakdown. Okay. So pila ka items for our final exam for the before midterm and after midterm. Before it's 40 and after it's 60%. Okay, so May 28th, final examination. Then instead of having oral examination, we'll have case study report. So the deadline for the written report for case study, June 4, 6 p.m. Okay, so later, after our rationalization, I'll give you the instruction and also the groupings for the case study. Okay, so let's start with our rationalization for our midterm examination. So let me share my screen. Okay, so for the second part of our midterm examination, so for the answers, first item, it's acute pancreatitis because of the elevation in amylase and lipase. Okay, so it's acute pancreatitis. Then for number two, it's alcoholic hepatitis because the AST level is higher than the ALT level. Okay, so if you're going to compute for the Diritis ratio, it's less than 1.0. Okay, and Diritis, it's ALT AST. So the numerator, it's ALT divided by the denominator, which is 320, your AST level. So 210 divided by 320, the answer is less than 1.0. So it indicates that there is alcoholic hepatitis. Okay. Then for number three, it's viral hepatitis because ALT is higher than the ALT concentration. So the Diritis ratio is greater than 1.0. Okay. So number three, it's viral hepatitis. Then number four, um, answer is obstructive jaundice. So for this item, you have ALP and GGT elevated. So if there's increase in ALP, there are two diseases that are highly associated with increase in ALP. You have obstructive jaundice and Paget's disease. Now, if there's elevation in ALP, the enzyme that you need to, or you're going to, the test that you're going to perform is GGT to differentiate the increase in ALP. So for GGT, it is elevated in obstructive jaundice and normal in Paget's disease. Okay, so for number four, it's obstructive jaundice. Now regarding GGT, it is also used to detect occult alcoholism, okay, or hidden alcoholism, okay. So if you're alcoholic, then you're undergoing rehab for alcoholism, then the doctor, your doctor, will know if nagatake ba kag alcohol using GGT. Okay? So that's for the use of GGT. So number four, it's obstructive jaundice. Number five, it's Paget's disease because the GGT level is normal and ALP is increased. Okay? Then, last, salivary gland inflammation. So for salivary gland inflammation, AST, no. Amylase is elevated while lipase is normal. So highly indicative siya of salivary gland inflammation, possible. Okay? So the answer is letter. No, the answer is salivary gland inflammation. No elevation in lipase. Okay, so those are the answers sa part 2. Okay, so let's proceed to part 1. Okay, so for part 1, first let me share the answer sheet and the answer key and the questionnaire. So I'll post the file. Desktop. Okay, so go to your virtual classroom and click long and term examinations. Okay, go to your virtual classroom and click uh, long and term examinations. Okay, then scroll down. Okay, and click midterm rationalization. Midterm exam rationalization. Okay, and open that file. Okay, so that's the questionnaire and answer key. Okay, so let's start with our rationalization. Okay, so first item, hemoglobin is a product of bilirubin metabolism. That is false. And amylase is an enzyme needed in the catabolism of starch. True. So answer is letter B. Then next item, an elevated total amylase concentration is specific to pancreatitis. It's false. It's not specific. This is specific. Okay, the elevation in amylase, total amylase, is not disease specific. Okay, and for the second statement, urine amylase is elevated in acute pancreatitis. It is true. Okay, so if there's acute pancreatitis, there's increased serum amylase. And if there's increase in serum amylase, there's also increased removal of amylase. So the effect of that increase in removal of amylase from your circulation is there's increase in urine amylase. Okay, so answer for the second item, it's letter A, not letter B. Okay, first statement is false, second statement is true. Then third item, in acute pancreatitis, amylase clearance is increased. Uh, ano, in acute pancreatitis, amylase clearance is increased, yes. Fallopian tube is a major source of amylase. No, it's a minor source. So the answer is letter B, not letter A. Okay. Next, delta bilirubin can react directly with the diazory agent. Yes. Okay. So delta bilirubin has the same characteristic with B2 in terms of the ability to react with diazory agent. Okay. The next is in prehepatic jaundice. So any type of jaundice, it's associated with increase in total bilirubin. That's why it's that's why that disease is called jaundice because of the elevation in total bilirubin. Okay. So in prehepatic jaundice, the total bilirubin is elevated. True. So the answer is letter C. Next, in posthepatic jaundice, ang total bilirubin is elevated. Yes. Accelerant is needed for bilirubin 2 to react with the diazory agent. No, because for B2, no need na for the presence of accelerant for it to react with the diazory agent. That's why the other term for B2 or bilirubin 2 is direct bilirubin. Okay, so answer, it's letter B. Next, bilirubin 1 is elevated in Gilbert syndrome. True. The cause of Gilbert syndrome is a deficiency in the enzyme that facilitates conjugation of bilirubin. Uh, False, because for Gilbert syndrome, there's no conjugation deficit. Okay, uh, uh, conjugation deficit is not the cause. The cause is there's transport deficit. Okay, so answer, it's letter B. Next, icterus is the deposition of bilirubin in the brain. False. Uh, Kernicterus is the deposition of bilirubin in the brain. Okay, icterus is different from kernicterus. Icterus means jaundice. Okay, kernicterus, that's the deposition of bilirubin in the brain. The accelerator in Jurassic and Groff method is caffeine. True and also false. So answer for this one, it's letter A and D. Okay. So why false, sir? Because incomplete. Okay. So A and D. Then next is bilirubin 1 and 2 are elevated in hepatocellular disease. True. B1 is elevated in patients with G6PD deficiency. Now, regarding G6PD deficiency, it's a disease where there's a deficiency in G6PD, and individuals with G6PD deficiency are prone to hemolytic anemia. Okay, why? Because if the patient or a person has deficiency in G6PD, that G6PD is needed to prevent early oxidation of cells. Okay, meaning if you have deficiency in G6PD, your RBCs will have shorter lifespan. Okay, so shorter nga lifespan, meaning there's increase in the release of hemoglobin. And if there's increased release of hemoglobin, you have increase in B1. So the answer for this item is letter C. Okay. Next, salivary gland inflammation increases the clearance of amylase. True. In macroamylasemia, when you say macroamylasemia, it's the combination of amylase and immunoglobulin. So it will form a complex that is big and it's difficult to eliminate or to remove from your system. So there will be a buildup of macroamylase in your system or in your circulation. So serum amylase is elevated. So for this one, the answer is letter C. Now regarding salivary gland inflammation for the first statement or mumps, for mumps, it's a rare disease na. Nowadays, it's a rare disease. Reason why it's rare nowadays, it's because of vaccination. Okay, so vaccines work. Okay, same with how the world deal with polio. Okay, so there was a time nga ang polio was completely eradicated, and that's because of vaccination. But today there are a few cases na pud of polio. It's because of the anti-vaxxers. Okay, there are people nga they don't believe in vaccines, so that's why there are few cases na of polio virus right now. So for us to prevent some of the viral diseases, we need vaccination. Okay, same with how the world handle COVID or this pandemic. Okay, so I think we're in the near na sa end sa pandemic, and it's because of vaccination. Okay, that's why during the start of this pandemic, April, May of 2020, there are a lot of people who posted or mentioned about mass testing. Okay, and I don't agree with that mass testing, because if the approach of your government or the world is to increase testing and we abandon vaccination or we neglect vaccination, then testing is not that effective in preventing what you call this transmission or future infection of COVID. Okay, why? Because if you're tested, okay, so for example, today you're tested and your result it's negative. After a few days, you're not safe against COVID. Okay, same ragyapon ka o have same possibility or risk of acquiring COVID after testing. Okay, so I don't know why dahan kayong individuals who posted about mass testing. It's vaccination. If we want to end the pandemic, it's through vaccination. Okay? We need to prevent the transmission. Okay? So, testing is a small factor, okay, in dealing with this pandemic. The most important factor it's vaccination. Okay? Because that's how we deal with polio, di ba? Okay, and other diseases. It's through vaccination. Okay? There's no PCR back then. Okay? But nga naman nga na-deal ang polio, it's because of vaccination. And that's the thing, magsiimo silang mention about mass testing. Nga, we need vaccination. Okay? Now, regarding vaccination, example no, the province of Siquijor, I think they reach herd immunity faster compared to Negros Oriental. They reach 70%, okay, uh, of their population fast sila compared to Negros. It's because of their PHO, okay, provincial health officer, okay. Their PHO is aggressive in vaccination rollout. Okay, they're doing house-to-house vaccination. Okay, for those people who are don't have time to go to the vaccination site. Okay, and if there is a person who is an anti-vax, okay, they'll try to convince it by giving them 5 kilos of rice. Okay, they're so aggressive. Okay, the health health team ba na or sa mga the group of doctors sa Siquijor are active or aggressive. Okay, in finding ways to um, convince the people to have vaccination. Okay, that's why early sila nagka herd immunity. Okay, so it's because of vaccination. Okay? So wala lang, katawa lang ko atong mass testing. Okay? It's not a nice approach. Okay? Because after testing, there's a possibility gyapon that you'll be exposed to a person, okay, na positive to COVID. Okay? But sir, we're what if all of the Filipinos daw okay negative for COVID? Now, in, think of it. In your virology or in your immunoserology, di ba there's incubation period? Okay? That time, a person with uh, virus or infected with virus will have a negative result. Okay? So that's why ang testing, dili siya inana ka-effective in preventing transmission. Okay? It's because there is incubation period. Okay? So, muna, nakatawa ko siya ng mass testing. Okay? It's vaccination. Okay? Vaccination. Okay? So, let's continue with our rationalization. So, amyloclastic method for amylase determination uses starch as substrate. Yes. Regarding the methods for amylase measurement, the usual substrate it is or the substrate for all methods for the measurement of amylase, it is starch. Okay, the substrate it is starch. Okay, so amyloclastic, yes, the substrate is starch, but amyloclastic method is not the reference method. Okay, it's sacharogenic. So answer is letter B. Okay, now next item. Yes, Miss Sumalpong.
Excuse me sir, sorry to interrupt. Ang answers lagi uban sa items diri sa document na imong gi-upload sir kay dili mao ang imong gipang mention na answer sir.
Yes,
Murag,
because that's the correction.
okay, okay. Sige
Oh,
sir.
yes.
Okay.
Ang akong dimension, that's the correct answer.
Okay, thank you
And
sir.
you need to correct the answer, you need to change the answer key. Okay? So,
Thank you sir, sorry sir.
Okay. Sige. Next, regarding saccharogenic method, okay, it's not based on color development. Okay, it's based on the production of um, reducing sugars. Okay, so for for this item, okay, so the first statement is false. And for chromogenic method, that's the another method for amylase measurement. It also uses starch as substrate. So the answer is letter A. Okay, letter A. Then next, lipemic sample decreases amylase concentration. Okay, now regarding amylase and regarding lipemic sample, TAG or elevation in TAG inhibits lipase. Okay, so if the sample is lipemic, okay, the cause of lipemia, diba, it's either the presence of chylomicrons and VLDL. Okay, because those two lipoproteins are the carriers of uh, triglyceride uh, or TAG. Okay, so if the sample is lipemic and the patient did not fast, then the cause of that lipemia, it's because of chylomicrons and triglycerides, the exogenous triglycerides. But if the patient fasted for 12 to 14 hours and the sample is still lipemic, then the cause of that lipemia is it's because of the presence of VLDL and the endogenous TAG. Okay? Now, regarding TAG, so it inhibits amylase. Okay, correction, it inhibits amylase, meaning if the amylase enzyme is inhibited, meaning there is less conversion of substrate to product, meaning there is decrease in the concentration of amylase because of decreased activity of amylase. Okay, so uh, it's true. Okay, lipemic sample decreases amylase concentration. And morphine increases amylase activity because morphine causes constriction of the pancreatic duct, leading to increased activity of amylase. Okay, so letter C. Next, lipase facilitates the catabolism of starch. An increase in lipase is specific to pancreatitis. The answer is letter D. Okay, false. Okay, um, if there's increase in lipase, it's not disease specific. Okay, there are other diseases with increase uh, that are associated with increase in lipase. But if we are talking about significant increase in lipase, usually it's because of pancreatitis. Okay, so answer for this one is letter D. Both statements are false. Next, lipase is elevated in cases of salivary gland inflammation. No elevation, it's false. Fatty acid is a common substrate in the measurement of lipase activity. It's also false. So letter D. Next, hemolysis would result to increase in the concentration of amylase. False. And serum is an acceptable specimen for lipase concentration measurement. It's also false. The next, ALP is increased in cases of hepatitis. Yes, there is elevation, slight elevation in liver ALP. Okay. Increased intestinal ALP is seen in cirrhosis. No, it's liver ALP, not intestinal ALP. So the answer is letter B. Okay. True, false. The next, calcium activates alkaline phosphatase. It's magnesium. Okay, so the answer is letter D because the second statement, liver ALP is elevated in fatty is the isoenzyme that is elevated. Okay. Next, total ALP is increased during pregnancy. Yes. And intestinal ALP is usually elevated during teenage years. It's bone ALP. Okay, so it's true, false, letter B. Next, liver ALP is the least anodal isoenzyme. No, it's the most anodal isoenzyme. So it's false. And electrophoresis can separate the different isoenzymes of ALP. True. Okay, so answer it's letter A. The next, liver ALP is normally elevated in children during periods of growth. It's bone ALP. Then bone ALP is usually increased due to osteoclastic activity. False. So false, false, letter D. Next, placental ALP is the most heat stable among the four isoenzymes. That's true. Phenylalanine inhibits the activity of intestinal ALP. True. So letter C. Then, next item, Regan ALP is a tumor marker. True. Regan ALP is inhibited by phenylalanine. That's also true. Next, the substrate in Bowers and Macomb method is p-nitrophenyl. No, it's p-nitrophenyl phosphate. Okay. Hemolysis has no effect on ALP concentration. There's slight elevation. Okay, in ALP if there is hemolysis. Okay, so it's false, false, letter D. Next, ALT is the first marker to increase in cases of liver disease. No, it's AST. Okay, AST is a standard in the diagnosis of myocardial infarction. No, it's troponin I. Okay, so false, letter D. Next, Carmen method is for the determination of ALP concentration. Carmen, it's for AST. For ALP, it's Bowers and Macomb method. Okay. Vitamin B12 activates AST. It's vitamin B6. So false, false, letter D. Next, AST is increase in muscle injury. True. Hemolysis inhibits the activity of AST. No. If there's hemolysis, there's elevation in AST because of the release, okay, of AST from the damaged red blood cells. Okay, so it's false. So the answer is letter B. Okay. Next, the use of heparin increases the concentration of AST. False, because heparin inhibits AST. Okay. Next, serum is an acceptable specimen for AST activity measurement. It's true, letter A. Okay. Next, higher elevation of ALT is seen in extrahepatic than intrahepatic. False. Okay. ALT is higher, okay, in intrahepatic than extrahepatic conditions. Okay, so ALT is slightly elevated in cases of AMI. False. So answer is letter D. Next, which of the following would have a Diritis ratio of less than 1? It's letter B, alcoholic hepatitis. Then AST and ALT are elevated in cases of muscular dystrophy. False. ALT is not elevated in cases of acute pancreatitis. That's true. So answer is letter A. Next, total LD is highly specific to hematology conditions. False. Total LD is not disease specific. That's why you need to separate the different isoenzymes to increase the specificity of lactate dehydrogenase. Now, regarding LD2, the subunits or the polypeptide chain present in LD2 have 3H and 1M. So, answer for this item, it's letter A. Okay, letter A. Then, next, LD4 is abundant in skeletal muscle. True. Okay, 4 and 5. LD3 is a tumor marker. True. Letter C. Next, LD2 is the fastest isoenzyme of LD to migrate in electrophoresis. It's LD1. Next, LD is the major isoenzyme of LD in a healthy individual. It's LD2. Okay, so answer is letter D. Next, Walker and Wroblewski. Walker method uses lactate as substrate. That's true. Lactate is the more specific substrate for lactate dehydrogenase. It's also true. So answer is letter C. For Wroblewski-Ledoux, it uses lactate as substrate. No, it's pyruvate. Okay, so Wroblewski-Ledoux, the substrate, it's pyruvate. This is the reverse method. Walker is the forward. Okay. Wroblewski-Ledoux method has a faster reaction rate compared to Walker method. That's true. Okay. So the answer is letter A. Okay. So for Wroblewski, it's the reverse, faster reaction rate, and pyruvate is the substrate. For Walker, it's the forward reaction, and lactate is more specific substrate for lactate dehydrogenase. Okay, so those are the answers for our midterm examination part 1 and part 2. Okay, so next, after rationalization, next we'll have the groupings for our case study. So, I thought man good nga June 11 is the last day for second semester, but it's June 4. So we need to remove one activity, and that is oral examination. So instead of having oral examination, we'll have case study. Okay. So for the case study, it's a group activity, and I divided the section into 6 groups. Okay. So there are groups with 4 members and one group with 3 members. Okay. So for the groupings, so for the first group, the members for the first group, we have Ahir, Alo, Bildad, and Tamonang. Okay. So group 1. For group 2, we have Cabildo, Cabual, De Jesus, and Siana Trasmonte. Okay. Then for group 3, we have Downing, Eligado, Gales, and Fred Trasmonte. Okay. Then fourth group, Indog, Hakalan, Camera, and Tumandas. Okay. Fifth group, Narciso, Rafales, Ramirez, Vergara. Okay. And last group, okay, Sanselan, Sotilio, and Sumalpong. Okay, so those are the groupings for case study. Okay, so later, after our synchronous class, I'll send you the case, okay, for your group. So one case per group and one output per group. Okay, so what are the contents, okay, of your case study report? Okay, so first, di ba, you have your case. So I'll send you the case after our synchronous class. Okay, so you have your case. So first thing that you need to do is to identify the disease, okay, of the patient, okay, sa imo ang case. So after diagnosis, after the identification of the disease, next is research about that disease. So for example, diagnosis is diabetes mellitus type 2. Okay? So in your case study report, the first content will be the cause or causes of the disease. Okay? So research about the cause of the disease, okay, or causes. Okay? Number 2, you have the risk factors, okay, of that disease. Okay? Then third, you have signs and symptoms. Okay? Then fourth, you have the pathophysiology. Okay? So for your pathophysiology, you need to make a diagram. Okay? And explain that diagram. So for example, the disease, it's connected to the cause. So this is the cause and this is the disease. Then you have the complications. Okay? You have the signs and symptoms. You have those risk factors. Connect those things. Okay? And explain your pathophysiology. Same with cause, risk factors, and signs and symptoms. You need to explain. Will not accept an output nga for causes, it's bullet form lang and with no explanation. You need to explain things, okay? The causes, the risk factors, the signs and symptoms. And most importantly, you have your pathophysiology. After, for number 5, after pathophysiology, you have diagnosis. So for diagnosis, meaning the test that you need to perform in order to diagnose this disease. Okay? So, for example, for DM, you need fasting blood sugar. Okay? You can also perform other tests, okay, to diagnose DM. So, enumerate those tests, okay, needed in the diagnosis of that disease. Okay? Then, last, number 6, have treatment. So what's the treatment, or if there's no treatment, how to manage that disease? Okay, so these are the contents, okay, of your case study report. So it's written, it's encoded, okay. No need for you to make a video for this one, okay. So written report lang na siya. So regarding format, I'm not that uh, strict with the format or concerned with the format, but use Calibre as font, and font size is 12 and spacing is 2.0. Okay? I'm concerned lang with the content. Okay? Regarding saan eh? Sa tawagan na. Basta akong concerned, I'm not that concerned with format. I'm concerned with the content of your report. Okay? So these are the things should be present in your case study report. So causes, risk factors, signs and symptoms, pathophysiology, diagnosis, and treatment. The deadline for this one is June 4, 6 p.m. One output, one submission per group. Okay? Questions? Yes, Ms. Narciso?
Through email ang pag-submit po, sir.
Yes, via email lang.
Another question, sir, regarding po sa score sa exam po, sir, for our
Hmm.
midterm. Na-change na tutuod, sir?
Wala pa. Maybe
Okay,
within this week or next week, ma-change na to siya.
Thank you so much, sir.
Mm-mm. When due ang case study, Elisa? Ang case study, deadline June 4, 6 p.m. June 4 lang ta because that's the last day for the second semester. Okay. So instead of oral examination, let's have case study na lang. But I prefer oral examination gito ta. But we don't have time na. Okay. Regarding assessment, it's nice to have oral examination for assessment. Okay. But mas better ang oral exam if face-to-face. Okay. It adds pressure. Okay. Ano lang. Nice man ma-pressure. Okay. Hindi na mo ma-test how confident the student regarding sa yung answers. Okay. So I think that's all. Okay, so next meeting, final exam, comprehensive, so 40% before midterm and 60% after midterm. So after this one, after our class, okay, after our synchronous class, proceed to asynchronous. Okay, so for asynchronous, you need to watch the discussion regarding potassium, calcium, and magnesium. Okay, so there are 3 videos, or mga 1 hour na siya in total. So watch those videos and download the handout lang. So it's better nga you'll watch it today. I think I've mentioned this last meeting na to in our mycology. The goal is not to be busy, huh? The goal is to be productive. Okay? So usually if you're busy, meaning you're not that good in managing your time. Okay? Because you're busy. That's the reason why you're busy. Okay? So don't be so proud na you're busy because it means na you're not that good in managing your time. Remember, the goal is to be productive. Okay? So be productive. Okay? And since this is our last meeting, no, I'll not be part of the um, faculty who are involved in internship, so I'm not handling interns next school year. So this is our last meeting. So hopefully you'll have fun in your internship, okay? And hopefully you'll be successful sa inyong mga endeavors. And remember, OA mo mga teacher, so night times nga mag-talk about I'm giving unsolicited advice to my students usually, okay? Even though my students are not asking for advice, still I'll give an advice, and that is unsolicited advice. Okay, so remember to practice extreme ownership. Huh? Okay, so meaning of extreme ownership: if you have failures, the reason why you're failing or you're succeeding, it's because of you. Okay, the reason why you have failures, it's because of you. The reason why you have success, it's because of you. Okay, don't blame others for your failures. Okay, if you blame others, meaning you have high or big ego because you cannot accept the fact that you're the reason why you're failing. Okay, so remember that one: extreme ownership. Okay, don't make excuses. Okay, so if you fail, okay, because in our life, no good, it's normal to face failures. Okay? Normal na siya. Okay? So you need to change how you handle failures. Okay? So i-accept ni mo nga you're the reason why there are failures in mong life. Okay? So that you'll improve. Okay? It's difficult for a person to improve if he or she cannot accept na she's the reason uh, for his or her failure. Okay? So, inana. That's extreme ownership. Okay? So, hopefully, butang na si mo utok ka. Okay? Ayaw jud i-blame ang other people or the circumstance. It's you. Okay? Usually, people are great in uh, taking credit if there is success, but they're not. Usually, people are not good in accepting their faults. Okay, regarding sa mga failures sa life. Okay? So, dapat fair ta. Okay? If success and failure, it's me. Okay? Inana dapat. So that we improve ta. Okay? So, if ever you have questions for regarding sa discussion for potassium, magnesium, and calcium, I'll entertain your questions next meeting from 1 to 1:30. Then by 1:30, we'll start with our examination, final exam. Okay, and you can also contact me via messenger if you have questions. Okay, so I think maraman to. That's all. Last thing, I'm not sure if I shared this one in our so to, mycology laboratory regarding Bible. Okay, Bible diba is a compilation of books, and my favorite book it's Ecclesiastes. Okay, so Ecclesiastes 9:11. Okay, chapter 9, verse 11. The race is not to the swift, nor the battle to the strong, nor bread to the wise, nor riches to the intelligent, nor favor to those with knowledge, but time and chance happen to them all. Okay? That's Ecclesiastes 9, verse 11. Meaning, if you're intelligent, right, does that mean uh, that you'll be successful in the future. Okay? If you're academically smart, doesn't mean and I'll have higher possibility to have success in the future or in life. Okay, for you to be successful, okay, uh, based on the verse, between a not so intelligent person and very intelligent person, the common thing between them, it's time and chance. Okay, it's how you handle your time and how you grab opportunities. Okay, take action. Okay, and use that opportunity. Okay, meaning it's about discarte. It's not about how intelligent you are. Okay, how knowledgeable you are, how wise you are. It's about madiscarte. Okay, how you handle opportunities. And there are a lot of opportunities. Okay, plenty of opportunities. Okay, remember, I'm not sure if I told you this one in our MyCollab. For you to make money, you need to solve problems. Okay, just like the doctors. That's why doctors have more money compared to other profession. It's because they solve more problems. Okay, so for example, there's a person with heart disease. So the purpose or the job of the doctor is to find a solution for that problem. Okay, so we need to offer solutions in order for us to gain more money. Okay, so why man sir important ang money? It's because, or why man nga it's nice to be successful. Okay, so in the future, hopefully all of you will be successful. Because if you're successful, it's easier to help other people. Okay? It's difficult to help other people if you're not successful. That's the truth. Okay? Why? Because you don't have the resources na maka-help sa other people. That's why you need to improve yourself so that you can help others. Okay? You need to be selfish first before ka mahimong selfless. Okay? Ang problem mo sa tao, una ang selfless. So, the tendency is no improvement. So, you need to focus on yourself first. Improve, improve, improve so that it's easier for you to help other people in the future. Okay? So, inana. So, kaniyang duha ang important. It's not about who's intelligent, who's knowledgeable, who's wise, who's strong. It's based on how we handle time and chance. Because the not so intelligent person, nasa 24 hours in a day, and also the very intelligent person. Okay? And regarding opportunities, remember the Philippines, our country, have a lot of problems, meaning more opportunities. Okay? If you solve a problem, you'll gain money. Okay? That's the rule. Okay? So wala lang, sharing lang to siya. And I think that's all for our class. Do you have questions? So don't ever think no opportunity there is a Philippines. Okay? There are a lot of opportunities. Example, let's prolong our class for short lang pag-prolong. So for example, your neighbor, the problem of your neighbor, they don't have cooking oil. Okay? So if you have sari-sari store, then you're selling cooking oil, then you solve the problem of your neighbor. That's basic nga problem solving. So for example, in your community you don't have potable water, then build water refilling station. Okay? That's an opportunity. Okay? Baling daghan ng opportunity. Okay? But we're so selective. Okay? Maot man, then no opportunity. Excuses. Okay? Filipinos are good at that. Okay, making excuses. Okay, inana. That's my view, because my God, it's Jesus Christ, and Jesus Christ is a God of abundance. So I never think na there's scarcity of opportunities in this world. It's because my God is Jesus Christ. He's a God of abundance. Okay, so if there's no question, thank you. Thank you for your time. God bless in your internship. Hopefully, you'll enjoy internship and hopefully, you'll be successful sa inyong mga endeavors. Okay? Thank you. Pwede na mo leave if you don't have questions. You can leave na. You may leave na if you don't have questions.
Sir, bye, sir.
Thank you, sir. Bye, sir. Thank you, sir. Bye.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir. Bye, sir.